So hi everyone, how's it going and welcome back. So I'm Patricia, and if you're new here, welcome. And if you're not so new here, welcome back. So on this channel, I talk all things related to wellness, lifestyle, healthy eating, rehabilitation and therapy tips and soul living. So in today's video, what I want to talk about, or what we're going to be talking about, is we're going to be talking about hip flexion and what hip flexion is. So you're going to see me standing next to my chart here, and this is so that I can demonstrate showing you some muscles in terms of what hip flexion is. So first of all, before we proceed, let's first of all understand what is hip flexion. So basically, hip flexion is when or anytime you bring your leg in front of your torso. So once you bring your leg in front, that is a representation of hip flexion. So if I'm bringing my leg forward, I'm actually in hip flexion now, right? But hip flexion doesn't always have to be in a standing position. You could achieve hip flexion even when you're lying down or you're in a lying position. So that's called supine. When you're on your back and you're lying down, you can also be demonstrating hip flexion, right? So hip flexion could also be, as I said, standing, lying, or you could also do it in a side lying position. So you could also extend your leg forward even if you're in a side lying position. So that in itself is hip flexion. Now hip flexion can also be done where you're extending your leg or you're bringing it up by bending the knee. So whether you're extending or you're bringing it up, you are actually in hip flexion. Hip flexion can also be done seated as well. So let me demonstrate that and show you. So if you're in a seated position, you could also demonstrate hip flexion. So once you're extending your leg, you're not seeing my leg, but I'm extending, that is in hip flexion. You could also bring your leg up, that is also hip flexion as well. So even within a standing position, lying position, side lying position, or seated position, anytime you're bringing your thigh in front of your body or in front of your torso, you are actually engaged in hip flexion. Whether, as I said, lying, side lying, standing, or sitting, you are engaged in hip flexion. So now that we understand what is hip flexion, let us now understand some of the muscles involved in hip flexion. Now, as you see, I'm sitting now next to my chart, and we have a few muscles on my chart that is responsible for hip flexion. But I don't want to touch here first. I want to first of all touch on two of the major muscles involved in hip flexion. And this is called the iliacus and the psoas, right? And the iliacus and the psoas muscles are muscles that are very deep within the hip itself. So they're very deep muscles that we cannot visually see with our naked eyes. So as much as we could see these other muscles that I'm going to show you that is involved in hip flexion from a superficial level, we cannot see the psoas and the iliacus muscle. Now, these two muscles combined together is called the Iliopsoas Muscle. So they are combined, though they are separate, they are combined and they are referred to as the Iliopsoas muscles. So these two muscles are muscles that are majorly involved in hip flexion. So for me to show you what that looks like, I would have to now jump on my computer to show you where those muscles are located and how they look. So let me jump on my computer now and I'll show you what that looks like. Now here we are looking at the psoas major and the iliacus muscle. And as you would see, they are located very deep in the pelvic. And you would see that here as I show my cursor running down on the psoas major, and the iliacus is here on either side and the psoas as well. Right? So as I said, it's very deep within the pelvic, so hence the reason we could not see it from a superficial level. So as I would have said before, these two muscles together is what is called the Iliopsoas muscle. Now let's first discuss a little on the psoas major muscle. And the psoas major muscle, as we are looking at it here, it has several origins. And the first group of origin I established on the lateral side of the T12 and the L5, and that will be located here where you're seeing the cursor, and it would run down to the L5, which is the T12 and the L5 vertebra. And it is also attached to the disc L1 and L5, right? So these are the discs between here, and they are attached to L1 to L5. So because of this broad origin of the psoas major, it is considered to be a convergent muscle because of the broadness of it. And as you would see, it then runs down inferiorly or distally to run down and connect to this tendon here. And if you're looking at it on this side, you would see how it's attached here, and then it runs distally or inferiorly, and it attaches into the tendon on the side here. Now let's look at the iliacus muscle. So in this picture, we're seeing, yes, the psoas major and the iliacus muscle together, but we're looking at the iliacus muscle and its origin. And the iliacus origin starts where it sits or lies inside of the iliaca fossa, which is inside of here, right, on either side. But it's a bit broader than just lying in the iliaca fossa, because as you would see, it goes up at the top here on the iliac crest, and it runs off of the iliac crest. It also is connected to the ilia of the sacrum, as well as the anterior sacroiliac ligament, right? And that is the attachment or the origin of the iliacus. And it's also broad in terms of its origin. And you would see that it also runs down distally or inferiorly down, and it narrows itself down and goes on the side here. So both the psoas major and the iliacus muscle, as you would see, they come down and they join on this tendon here, and it actually fuses together and they form a combined or conjoined tendon. And that tendon then goes in here and inserts on the lesser trochanter of the femur. So both of them have the same insertion point because they form this combined tendon at the bottom of the muscle itself, and then it joins into the lesser trochanter. So this is the reason why the psoas major and the iliacus is considered major hip flexors. And when it comes to its function is to stabilize the hip joint by pulling the femur inside of the socket, right? So that is one of its functions, to stabilize the hip. As well as another one of its function is external rotation of the femur. So that is basically hip external rotation of the femur. And although the major external rotators are the deep external rotator group within the gluteal region, even though it's not really one of the major external rotators, it also facilitates and contributes towards external rotation. So this is it here in terms of the anatomy of the psoas major and the iliacus muscle. And now that we have finished look at this, let's now jump back on the chart so that I can show you the other muscles that are involved in hip flexion. So let's go do that. So now that you have a clear idea of what iliacus muscle look like and what the psoas muscle look like, and together they are called the iliopsoas muscle. So now that we understand that, let's jump on the chart and let me show you what are the other muscles. So the second muscle that we're going to talk about is the rectus femoris. And the rectus femoris would be this muscle here, and it forms part of the quadricep muscles. And though the rectus femoris is responsible for knee extension, it is also responsible for hip flexion as well. So the rectus femoris is the second muscle, if we consider iliopsoas as one muscle responsible for hip flexion. So the next muscle, or the third muscle that contributes to hip flexion, is the Sartorius muscle. And this muscle is a very slim muscle that runs across from the top of the iliac crest around here, and and it runs straight down and inserts to the side of the knee. So that is the other muscle, the Sartorius muscle, that is a contributor to hip flexion. And the fourth muscle that is a contributor to hip flexion is the tensor fascia latae. So I'll put a picture of the side of the tensor fascia latae, since that we may not be able to necessarily see it from this angle as I'm pointing here. So those are the four muscles that are responsible for hip flexion. So we have the Iliopsoas, we have the Rectus Femoris, we have the Sartorius Muscle, and we have the tensor fascia latae muscle. Now, I want to also share with you or show you the conditions or the contributing factor under which these muscles operate, right? And I'm going to demonstrate it for you and explain it as we go along to show you which muscles are working and doing what as I'm actually engaged in hip flexion, right? So as you see, I'm standing here now. I'm standing straight, I'm in a neutral position. So now I'm going to turn to the side and I'm going to raise my thigh in hip flexion, where I lift my thigh into a 90 degrees angle. So as I'm in this flexed position, as you could see, all the muscles that we spoke about, I am engaging at the moment. Now, these three muscles, which are the rectus femoris, the sartorius, and the tensor fascia latae, these muscles are extremely shortened right now. So anatomically, they have reached their limit in terms of where they can go, right? So with the fact that they are actually shortened to that extent, it would be that they cannot carry, or the action of carrying the thigh to a greater extent to go further upwards if we had to shift in hip flexion to more than 90 degrees. So seeing that they are already shortened, if I should lift my leg now to a greater extent of 90 degrees, these muscles will become inactive. Rectus femoris, the sartorius, and the tensor fascia latae. They will become inactive, right? So if I decide now to carry my thigh beyond 90 degrees, what will happen is, for example, if I decide I want to lift my leg higher than that, or let's say I want to use force beyond 90 degrees, right? And if you can take it higher beyond 90 degrees on your own, right? What will happen at that point in time in taking your leg beyond 90 degrees? It will be that these three muscles, the rectus femoris, the sartorius, and the tensor fascia latae, would be inactive or inactive, and you would no longer be engaging these muscles because they would have reached their shortening limit. But now you would be actually engaging the Iliopsoas muscle, which would be the muscle that would be responsible for taking your leg beyond 90 degrees, right? So the three muscles that I spoke about, they could only take you to the point of which they're shortened up to, but beyond 90 degrees is where the Iliopsoas kicks in and takes your leg to be able to take it beyond. So any movement beyond that 90 degrees, like you're a dancer or you're a gymnast, or if you're kickboxing and you're doing any sport or any activity where you're extending your leg beyond that normal threshold, you will actually be engaging your Iliopsoas muscle that is actually allowing you to carry or travel to that distance. That's more or less the contributing factors of how these muscles work and as it relates to hip flexion. So with that said, I hope that with viewing this video you have like a better idea of what is hip flexion and the muscles and the contribution of each muscles as you engage in hip flexion. So if this video was of value to you, don't forget to like and subscribe, and leave me a comment below as well, and let me know what other videos you might be interested in seeing, and I can definitely do that for you. So until our next video, see you soon.